Hello, good afternoon, everybody. I am Rubini, one of the senior physiotherapists in Rehab Hospital. So today my topic will be about sitting disease, and why we are choosing sitting disease is because it is becoming a very common issue now. It is a disorder and it's been recognized by WHO, the World Health Organization. And I'm sure most of y'all with all these recent MCO, y'all have been at home and working from home. So mostly it's a lot of sitting, and so it is becoming an issue. So that's why we have chosen this topic to elaborate more and explain to everybody why is this becoming a disorder and how do we prevent it from happening. Okay, so moving on to the slides. So like I said, the topic would be sitting disease, and I'll be sharing a lot more about a bit more in depth about sitting disease, posture care. Why is posture care very important? What can you do? Because it's something that you can make changes, and simple exercises and demonstration of the exercises that you can do while you're at work. Right? So what is sitting disease? Like I said, it's actually been recognized already by WHO. It's actually sitting too much and exercising too little, and is commonly used when you're referring to a metabolic syndrome and all the negative effects of an overly sedentary lifestyle. It's a term used to describe individuals who engaged in prolonged sitting, anyone who sits in office for more than 5 to 6 hours, 7 hours, or any, driving for a long period of time. It's actually engaging in prolonged periods of sitting. So most people, you may think that it's harmless because you're just sitting, you don't feel any pain, but you'll be surprised with all the negative effect that it has on your health. Okay, so like I said, you may think that you're only sitting at your office for about 7 hours per day, but by looking at this graph, you can actually see that you're having your lunch 30 minutes. Total sitting hours would be about 15 hours because you drive home 1 hour with all the jam that we are facing these days. Here there is strength training, but I don't think everyone does strength training. So minus off the strength training, and then we'll be eating for our dinner also about 30 minutes and an hour. And when we are watching TV, we're also sitting. So in general, our daily activity, especially for those who are working at desk, when your work is related to desk job, roughly you're actually sitting about 15 hours in a day. Okay. So why sitting too long, sitting for prolonged period and for hours could be dangerous for your health? So estimate roughly in a day for those who are working at office, you usually sit for about 7 hours to 8 hours. So as a physiotherapist, we see a lot of patients that are coming in with a lot of neck pain, back pain. So over here, sorry, strained neck is actually one of the most commonly seen issues among in our patients. So neck pain affects 10% of our world population each year. So again, whenever we ask our patients what kind of job are you doing, it's always been desk job. It's always been sitting for a long period of time in the desk doing computer work. So that's why we're seeing there's a lot of issues that are being faced by people who are having this sitting disease. Okay, so that's strained neck. The next is back pain. It could be upper back pain and also lower back pain. So it's written here, back pain is one of the most common reasons for lost productivity. So whenever you have back pain, obviously you'll be having difficulty to, perform at your work, perform at your job, because, it is disturbing you during your working hours. And also there is people with the most, also heart disease. So people with the most sedentary lifestyle are 200% more likely to have heart problems. Also related to colon cancer, that means extra 2 hours of sitting daily is linked to an increase in 8% of colon cancer risk. We also have a lot of people with joint pain. Again, we always see patients with strained neck, we always see patients with back pain and joint pain. Very common, and most of it is due to sitting because prolonged period of sitting. Okay. Moving on, I'm just sharing with you all some 10 sedentary lifestyle statistics that you probably, once you start reading all these, you might want to think that you should get off your chair more often. So the first thing is a sedentary lifestyle increases death rate by 71%. You could be exercising regularly. Let's say you're sitting down for 7 hours at work, but after that you're still exercising vigorously like 4 to 5 times a week. It still increases your risk of death because at one point of time, you're sitting for a very long period of time. So we need to break that pattern of prolonged period of sitting, okay? Also, there's a lot of research that shows that people who sit for more than 7 hours are more likely to develop depression, dementia, and Alzheimer. Depression, they say, because you're sitting for a prolonged period of time, so there's lack of all these happiness hormones, which it's serotonin and dopamine and endorphins. That is because of the lack of circulation. So all these hormones are not reaching the receptors. So that's why people are more likely to develop depression and etc. And yeah, in this they're showing that women are more likely to be physically inactive than men. Not too sure why, but I think all the women needs to start exercising more. Sitting for prolonged periods of time is linked to more than 100% of increase in the risk of diabetes. So they also say that since 1950, the sedentary jobs have increased by 83%. That means most people are actually doing desk job. That means sitting for long hours of time, because all those work that requires more tough is being taken over by robot or automation industry. So people don't have to work so hard. Hence, the sedentary jobs have increased these days. Okay, and people who sit for 30 minutes or less, they've actually done also research. They have lesser risk of death compared to people who sit longer. So they're saying here that if even that you're sitting for, like you're working and you need to, your work requires you to sit for a long period of time. If every 30 minutes you can stand up and do some exercise, you're actually sitting for only 30 minutes, because after that you're breaking back your pattern. You're not sitting for a very long extended period of time throughout the whole day. Okay, so moving every 2 minutes every hour can decrease premature death. Again, every 1 hour, just try to move about in your office, try to do some exercises. I will share some simple exercises that you can do throughout your day at work. So try to fit in those exercises every hour or every 30 minutes. So they also say sedentary behavior increases the risk of some types of cancer, very commonly colon cancer. So again, researchers have shown all these statistics. And 6% of death globally are linked to physical inactivity. So it's about moving. The more you move, the lesser your risk of having all these secondary complications. Okay, and the last one, cardiovascular disease risk goes up to at least by 147% for people with higher levels of sedentary behavior. So if you see, for those who are sitting for long hours and your daily thing is just very sedentary, your cardiovascular risk is actually going up. And we're actually seeing more patients these days with cardiovascular disease because of, again, the job these days are mostly sitting. All right. So I'm going to speak about musculoskeletal disorder. So as a physiotherapist, like I said, we deal a lot with musculoskeletal disorder. So what is musculoskeletal disorder? MSD is a disorder of the muscles, nerve, tendon, ligaments, joints, and spinal disc. So these are usually the MSD disorders. So like cardiovascular disease is all other non-communicable disease, but this one is something that as a physiotherapist, we see regularly with our patients, with our clients. Okay, so the most common pain area that is seen in our patients is always the neck, because you're always seated in a very poor posture. Maybe initially you're sitting in a upright posture, but eventually when you start focusing on your job and you start sitting for a very long period of time, you tend to slouch your posture very much, and that's when you start getting a lot of neck pain. I'm sure it's very common among those who are sitting. If you're working at work, very commonly you start having a lot of neck pain, followed by, actually the main one is low back pain. Low back pain is about 63%. Again, very common, followed by neck, 53%. Shoulder, why shoulder? Why do you get a lot of shoulder pain? Is because when your posture is poor, you tend to compensate. Your shoulder movement will not be able to perform to its fullest function, because your shoulder blade is moving out of position when your posture is poor. So hence your shoulder joint is not being able to perform as usual. That's why you get a lot of shoulder pain. We see a lot of desk job people who has wrist issues also. The most common wrist issue that is actually the carpal tunnel syndrome, where you get numbness in the first 3 fingers. It's very common, because why you're getting wrist pain is because usually when you're compressing your wrist joint against the table, your desk, or when you're holding your mouse, that's where you get a lot of numbness here, because your median nerve, there's a nerve passing by through here. So your median nerve gets compressed. That's when you get this issue called carpal tunnel syndrome. So it's actually a lot of positioning, simple exercises that you can do, a lot of awareness throughout your working period of time that will help you to reduce all these possible issues. So the common thing, people come in, they say pain. Like I said, why pain? Because that's how you. Pain is not normal. Pain, that means there's some issues. So please do rectify when you feel there's some pain. People complain of numbness. Why there is numbness? Because whenever, like I said, whenever your nerve is compressed, that's when you start getting numbness. Usually that's always the case. Sometimes you have numbness radiating down your leg. That means one of your nerve is compressed at your lower back. People get soreness. Soreness is usually due to muscle. Soreness is similar, like when you over exercise, you get a bit of soreness. That is actually soreness. Tightness is also related to muscle. Why you get tightness? Because if your muscle is in a same length in a certain position, is in a shortened position for a prolonged period of time. Let's say, like I said, if you sit too long, you have this hip flexor muscle which is in the front here, and the front of your hip, it gets tight because you're sitting for very long and the muscle is constantly in a shortened position. So that's when you get tightness over there. I mean, these are the basic muscle that gets tight when you're sitting for a long period of time. I'll show you again in the next slide. You have muscle aching. So why you get muscle aches? Because your muscles are weak. So all these issues is actually, you can reduce the symptoms, or you can actually get better by strengthening your muscle. When your muscles are not strong, your muscles are not balanced. Our muscles are supposed to be balanced. That means everything working at the same pace. But if you're sitting in a poor posture and you're sitting for a long period of time, you don't stretch your muscle, that's when one group of your muscle gets tight, and that's when you get all the other difficulties. You get all the pain and the stiffness. So here is muscle aching. Stiffness over here is usually in your joint. So again, like you're not moving much. At one point of time, your joint becomes stiff, because joints are meant to move. All of us are meant to move, but once you're constantly being in a position, it just gets stiff. That's why we need to move our joint regularly. Okay. Moving on. Okay, so this is effects of prolonged sitting. So it's something very common. It's called the upper cross syndrome and the lower cross syndrome. So this is the upper cross syndrome, the first picture. Also, so these two syndrome is something that has been classified and has been associated a lot with people who sit for a prolonged period of time. So in upper cross syndrome, you see there's tight upper trapezius. Upper trapezius is actually your neck muscle over here, and also your levator scapula, because you're sitting in a slouch position. So this muscle, this is your upper trapezius, it gets very tight. So when it gets tight, that's when you get a lot of pain and spasm, and you won't be able to, you feel a lot of discomfort. And when your one muscle is tight, the opposite muscle over here gets weaker. That's how the syndrome works. It's called the deep neck flexor. So our muscle has to be strong to be able to hold our joint. When our muscles are strong, you don't get pain, because the load is going to the muscle. The muscle are the one who's supposed to take the load, not the joint, because they are not supposed to be working too much. So that's why we always advise and encourage and teach all our clients to strengthen the muscle. All right. So over here, like I show, like in the picture here, there's tight pectorals. Pectorals is actually your chest muscle. So why you're getting tight pectorals? Because you're always sitting like this. So the fibers here, which is your chest muscle, gets shortened. So when all this muscle gets shortened, that's when you get tight pectorals. All right. And the opposite muscle, which is the back, at the back here at your scapula, is called the lower trapezius. It becomes weak. So your scapula is supposed to be in a certain position. Scapula is your shoulder blade. So because the pectorals here is tight, so the back shoulder blade starts moving outwards, because this muscle is tight, so it's pulling. So since it's pulling the shoulder blade in an awkward position, that's when you get all your lower trapezius weaker, and it's not in a proper alignment. So all this causes muscle imbalance. So that is when people get a lot of neck pain. So in lower cross syndrome is actually why people get back pain. That is usually the common symptoms. So you have weak gluteus maximus. What is weak gluteus maximus? Is actually your buttocks muscle. Most of us, because we are sitting, so your buttock muscle is just non-active. That means it's just sitting. There is no activation done in the gluteus maximus. And our glutes muscle is actually one of the strongest muscle in our body. But most of the clients that we see, they have very, very weak gluteal muscle. And because your gluteal muscle is very weak, that's when you tend to overload your lower back muscle. And hence you get a lot of lower back pain. So it's whenever you go for therapy, we'll always teach you, whenever you come for physio, we'll teach you not only to strengthen and stretch your lower back muscle, we'll teach you to strengthen your glutes muscle. If your glutes muscles are strong, you don't load your lower back too much. Okay, and then you get the tight iliopsoas over here. This is the muscle that I told you, the hip flexor, which is at the front of your hip. Because you're sitting for a prolonged period of time, so that muscle is in a shortened position. So it has to be stretched. All muscle has to be in a balanced position. If one muscles are tight, you will get a lot of issues. So when your gluteal maximus is weak, you get also weak abdominals, very commonly seen. So when your abdominals are weak, our abdominals is actually our core muscle. When our core muscles are weak, we tend to get a lot of lower back pain because there is no muscle to be able to hold up our trunk. And whenever you're doing activity, your trunk should be strong, your core should be strong. So when you come for physio, we'll teach you all the exercises to stretch the weak muscle. We'll teach you to teach you to strengthen the weak muscle and stretch all the tight muscles. Okay, moving on. So I'm going to talk about posture a bit. So what is posture? Posture actually refers to the body's alignment and positioning with respect to the ever-present force of gravity. So there's always gravity, and how much is our ability to keep our trunk upright without allowing the gravity to pull down. So sometimes because you're going slouching like this, because just the gravity is just forcing you downwards, but it's your ability to pull yourself up back, activate all the back muscles, your trunk muscles, to make sure you don't put too much of strain on your spine. Why is good posture important? So when you're having a good posture, you're distributing the force of gravity throughout in a very equally to your body, so that there is no one structure that is overstressed. So if you're sitting like this, there's probably this structure overstressed, you're straining your spinal joint. That's why you need to sit upright, so you're actually opening up everything and you're not stressing one part of your muscles or one part of your joint because of poor posturing. When do you have to maintain good posture? All day, every day. It's tough. That's why sometimes you need to change your positions. You just have to keep moving. If you tend to sit in a prolonged period of time at any certain days, that's when you start developing poor posture, because you naturally go into a abnormal posture. So you need to remember that regularly you need to start changing your posture so that you are aware, and you need to get a very good posture. Where do we maintain good posture? Everywhere. At work, at home, when you're in the coffee shop. Sometimes you sit like this, you're trying to do your work. That's when you're actually getting you probably develop tightness one-sided of your body. So, and that causes muscle imbalance. Eventually that causes pain and discomfort and things like that. Okay. Okay, why posture care? Good posture involves training your body to stand, walk. Like I said, it's every position. It's not only in sitting, but I'm talking about sitting disease a lot more. But it's your ability to train your body to stand, walk, sit, and even lie down in positions where there is least strain placed on the supporting muscles during any movement or weight bearing activities. So you don't want to strain any part of your joints, any part of your muscle or ligaments because of poor posturing, because that will lead to pain, and that will lead to discomfort, and that will lead to a lot of other things. Okay. So good posture prevents your spine from becoming fixed in abnormal position. Sometimes you're sitting one-sided, so if that's a poor posture, your spine just fixed in a very altered position. Sometimes it can, if it's for very long, it causes scoliosis. It's very common, sometimes that we see our patient, the abnormal curvature of the spine. So one side is lengthened and one side is shortened. So we have to recorrect it to make sure it's back to its place. So also prevents strain or overuse problem. Like I said, repetitive, a lot of just sitting like this, and this muscle starts getting overworked. That's when you get a lot of strain. People have a lot of backache and muscular pain. So by having good posture, you're preventing backache and muscular pain. You're also preventing fatigue because your muscles are being used more efficiently, allowing the body to use less energy. Like I said, example, your gluteal muscles, like your buttocks muscle is supposed to be the strongest, but a lot of people, because we are sitting, we don't use that muscle, we don't activate that muscle. Hence, we overuse our lower back. So the lower back is not supposed to take so much of work, not supposed to take so much of load, but because one is not functioning well, which is your glutes muscle, so the load is being transferred to the lower back. That's why you're getting a lot of back pain. So it's one problem is leading to another. So that's why you have to be very aware of your posture and try to regularly exercise again, and to make sure you're not straining one muscle at too much at one given point of time. Okay. Posture care also decreases, if you're very aware of your posture and you're maintaining good posture, you're decreasing stress on the ligaments holding the joints of the spine together. It also decreases the abnormal wearing of joint surfaces that could result in arthritis. So you know arthritis is something that you can't stop because it happens as you age, but you can prevent it from causing pain or prevent it from causing any dysfunction to you. Okay. So good posture also contributes to bones and joints in the correct alignment so that your muscles are being used properly. Again, the same point of thing. Repeating the same thing. You're contributing your muscle to make sure it's working to its fullest capacity instead of forcing another group of structure to work inefficiently. Okay. Again, also your good posture contributes to good appearance. Right. Moving on. So these are the normal common sitting posture that you always see. Over here, probably the chair is too low, and the way he's not like properly positioned. His arm is not supported on the first picture. Over here, he's hunching his trunk so much, and his neck is protruding towards the computer. So that's when he get a lot of neck pain, he get a lot of upper back pain. Over here again, same thing, similar, also hunching a lot. So always try to remember, you shouldn't be hunching. The more you hunch, you are actually pressing on your spine, and you're causing a lot of friction at all those discs around your spine. Okay, and so this is actually the good posture, the last picture, and how the guy is sitting. So similar, this guy over here, he is sitting poor posture. You see that it's lack of support for the back. On the other picture, the lady has a better support for the back, and she's sitting more upright. And the the desktop is actually same level, it's eye level with her, so that she doesn't have to hunch so much. Even now when I'm presenting to you, I'm making sure my posture is good. I'm not hunching too much to talk to you unless I'm giving example. And the guy over here, I'm sure a lot of people sit like this sometimes as well. So you can do this for maybe 2 minutes, 5 minutes, but if you're going to do this for a prolonged period of time, that's when you start getting a lot of issues and dysfunction in your body. Okay. So all these positions and posture may not seem like a problem when you're doing it because you don't have any pain, but eventually as time goes on, that's when you start getting a lot of you get a lot of discomfort, back pain. So it won't come in a day or two. It will happen when the problem starts arising when you're doing it continuously for maybe say 6 months, 1 year, 2 years without regular exercising. That's when you start having issues. You probably say, hey, why suddenly I'm having back pain? Why I'm suddenly having neck pain? I don't usually get this. So it's a process that happens in a long period of time. Okay, so this picture again shows how you should be sitting. So like I said, your entire back should be supported. You see, your hip should be as far as possible. It should be at the edge so that your back is really supported. And your knees level should be slightly lower or same level as your hips. It shouldn't be too high. And you should always remember your feet should be always on the floor. A lot of us, when you're sitting on the chair, our feet is not supported on the floor. It's always more you're sitting on your toes. So if you think the chair is a bit too high, you can put a block underneath your feet and support your feet so that your feet is very nicely placed instead of sitting in like this. All right. Okay, this is simple thing. I mean, it may seem a bit complicated, but I'm showing you. So when you're sitting, when you're not having a good posture, you actually, like, again, you're straining your joint so much. That's when your disc starts having issue. When you start having, people call it slip disc. You can actually cause your annula to just come out of the disc, and that's when you're having a lot of pain because it's compressing all the structures surrounding to your joint. So that's why you need to always maintain good posture so that your disc, for lower back pain, that your disc doesn't gets compressed. All right, moving on. In this is also in standing. Like I said, it's not only in sitting, but there's also in standing. And how do you correct make sure your posture is right when you're standing? The example over here, the person over here is sitting more erect, standing more erect, and the person over here is still having a bit of slouch posture and things like that. Okay. And this is also example of how you shouldn't be sitting. And over here, another example of how you shouldn't be sitting. So there's a lot of right and wrong. So maybe you can just try to read up more so that you're more aware of the right posture. Okay. Okay. So these are simple workspace adjustment that you can do at your work. So it's something, I'm sure you have heard the word ergonomics. Ergonomics is just, ideal way of setting up your posture, how you position the things surrounding you. You don't have to sit in a very high class chair or a very nice table, very ergonomic friendly table. You just have to make sure you're adjusting everything that is ideal for you, because every individual is different. So this chair may not be suitable for another person. So there's no such thing as this the best chair for to get the best ergonomic. It's just how you're adjusting yourself to the position that you are in. So maintain good posture, keep your back straight. Remember, don't slouch. Whenever you think that you're already slouching, stand up and move about. Stand up and move about, okay? So keep your head balanced. Don't always try to go forward to, type things, and when you're very much engrossed with your work. Position your monitor so that it is same level as your eye. So if it's too low, you tend to go this way, or if it's too high, you tend to extend your neck too much. So make sure it's the same level as your eye so that you don't have to tilt your neck too much up and down. Place your keyboard and mouse close to yourself so that you have support. Okay, so you have support and you're not doing this, or it's not too far away, or so basically having a good support for your arm and having easy access to your keyboard, right? Not too high, so just make sure it's at 90 degrees. Your shoulder and your elbow is about 90 degrees. Okay, and adjust your seat position, your hips a bit higher than your knees. So again, your foot has to be resting on your feet. Okay, rest regularly. Every 20 minutes you can take a break, to make sure you have, like I said, break your pattern of posture. Okay, so this is a H3S ideal work pattern. Very commonly, it's something very trying that everybody's trying to talk about it more often. So you sit for 20 minutes, you try to stand for 8 minutes, and you stretch for 2 minutes. So altogether in 30 minutes. For every 30 minutes, you keep changing your posture, your position. So the more you keep changing your position and posture, that's when you don't have all this issue related to sitting disease. Okay. Okay, so I'm going to talk about exercises. So I've talked about the sitting disease. I've spoken about posture care. Now a bit of exercise. I know a lot of people may not fancy exercise too much. So it doesn't only affect your health, it also affects how you perform at work. So all this research shows that your time management skills, your mental performance improves when you exercise, and you're able to deal calmly with any stress at your work when you are actually exercising. So whenever you're having stress, stand up, walk about every 30 minutes, just move about. It starts, you start releasing more, there's more circulation, and it starts releasing more hormones. That's where you get a bit more calm and you'll be able to perform at work better. Okay, so in the end, as humans, we need to move. Over here, I've shown you exercises. Humans are meant to move. You cannot be sitting in one position for a prolonged period of time. Okay, your muscles are meant to move, are meant to stretch, are meant to be flexible. And then the exercises helps to keep your joint fluid. So all these arthritis, you're actually slowing down the process of arthritis. Also, your exercises helps to keep your weight down. Okay. So there are types of exercises. As physios, 3 main exercises we usually prescribe to patient. You have the stretching. So basically stretching is trying to lengthen your muscle fibers. Like I said, there are some muscles that are tight. We need to make sure we lengthen our muscles, make sure it's not too tight. Mobility exercises, these are exercises that takes the muscle tendons and joint through the entire range of motion. Like if it's your wrist, it's the whole range, that is mobility exercise. Strengthening exercise is basically to strengthen the muscle. So if your muscles are strong, you don't load your joint is not loaded too much, you don't get pain, right? Simple exercises at your workspace. So this is all stretching exercises. So remember, stretches should be, whenever you do a stretching, it should be held for at least 15 seconds. So the picture shows that the lady is moving up and down, but ideally when you want to stretch, you just do about 3 to 4 times, but you need to hold it for about 15 seconds. So let's say you're putting it this way, so you should feel like a stretch over here, and those stretch should be hold for 15 seconds. That's the minimum. Just repeat 3 to 4 times every 30 minutes or every 1 hour. Regularly do these exercises. Of course, you need to do both sides. The more irregular stretching you do, you don't get all the tightness due to poor posture. Okay. You can also do tricep stretch, which is like this. Again, when it's a stretch, you need to hold for about 15 seconds. You don't have to repeat it for 10 to 15 times. You just have to do it for about 3 to 4 times. But make sure you're holding it for 15 seconds. Okay, so you can see the picture. The lady is moving very fast, but when you all are doing, make sure you're doing it very slow. Okay, and this is for your latissimus dorsi stretch. All this is doable at your workspace. It's not that difficult. You just need a chair. You just need a bit of space and a bit of time. So just hold on to the chair, just the way the lady is doing. Just open up your trunk to sideways, and you feel like a stretch over here. Okay, again, stretching exercise should be held for 15 seconds. Anything lesser than that is it's not effective because the muscle fibers are not being stretched well. Okay, this is pectoral stretch. Like I said, when you're sitting like this, your chest muscle with your pectoral muscle starts getting shorter, so you need to stretch it out so you can actually open up, stretch it for about 15 seconds, and then let go. Open up, stretch forward. When you're opening up, you're actually squeezing your shoulder blades together as well, so you're correcting your posture. Again, 3 to 4 times, 15 seconds hold. Okay, so like this is the wrist stretch that I said. People get a lot of wrist pain because of carpal tunnel syndrome, because you're always this way, so the median nerve over here gets compressed. So you can stretch it out by doing this in this position. Another reason for you to stand up instead of just sitting, you can also do this way, but I'm showing you this picture so that it gives you reason to stand up and do some exercises. Again, stretching, hold for 15 seconds. Okay, hamstring stretch, something very important, because hamstring is actually at the back of your thighs, the muscle at the back of your thighs. Sitting too long, that muscle gets short. When that muscle gets short, it tends to pull your pelvic in a different position. That's when you start getting a lot of back pain. So we always advise on regular hamstring stretch. So this is how you can do it. Just place your legs straight downwards and try to reach your toes. You should feel like a pulling pain at the back of your thighs. So that is actually hamstring stretch. Do it regularly, you're actually reducing your possibility of getting back pain. Okay, again, repeat 3 to 4 times. You don't have to do it very regular. At least, throughout your whole working period, 7 hours of working, you can at least do 4 to 5 times. Okay, another exercise you can do is quadricep stretch. Quadriceps is actually the muscle in the front of your thigh. Sometimes it gets tight as well, so you can stand and do this exercise. Another reason for you to stand up and move about. All these are doable in your office space, so I don't think there's any reason for you to not do the exercise. But you just need to be a bit more disciplined and a bit more, just try to remember that you got to stand up and wake up and do some exercises. Okay, so these are actually mobility exercise. Like if I showed you the stretching exercise, I'm actually holding for about 15 seconds because you want to stretch the fibers. So when mobility, you can actually just rotate. This is for trunk rotation, because sometimes you're just sitting one this way, but you need to learn how to open up and rotate both sides. Okay, you can repeat about 10 to 15 reps each side. You can, when you cross your leg over that way, you're actually stretching your buttocks muscles as well. But don't do this for a very long period of time. Some ladies, you like to sit with cross-legged, but you're actually causing tightness to one group of muscle. The opposite muscle gets very tight and this muscle gets too stretched. Okay, so you don't want to cause any muscle imbalance. A short span for you to do exercise, it's fine, but don't do it for very long. When you're sitting too long, try not to cross your legs. Okay. Another exercise that you can do is hip extension. This is actually to strengthen your buttock muscles, your glutes. If you're sitting for too long, your glutes muscle are actually very non-active. So like I said, you need to strengthen your glute muscles. So it's something that you can do. You just have to hold the chair. Make sure the chair has no wheels, because you might just, lose balance if it has wheels. So you can do this kickback exercise. Repeat about 10 to 15 reps each side. After 2-3 hours, you can repeat again. So it's actually not doing everything at one go. Is that if you can just break your time and do it regularly, it's more beneficial. Okay, and you're not spending too much of time on exercising during your working hours. Okay, so these are simple exercise. Also, you can do marching in a place, just standing straight, about 60 seconds, just march. Every 30 minutes, 1 hour, just stand up and just march. Or you can just walk about at your office. So there's a lot of exercises you can do at your working space. So there is no reason for you to say that, oh, I have no time, I cannot spend time, because all these exercises, I have no equipment, I have no space, because all these are doable. Okay. Another exercise you can do is partial squats. I'm sure squats is something very common for everyone. So you don't have to do a deep squat, but just, up and down, up and down. You can repeat it. Maybe hold it for about 2 to 3 seconds. All these are strengthening exercise. Your glutes are getting strengthened, your lower back is getting strengthened, your knees are getting strengthened. So a lot of benefits of doing squat exercise. Okay, so you can repeat this for about 10 to 12 times. Maybe after 2 hours, 3 hours, repeat again. Okay. If you're a pro, you can try to do this. It looks a bit hard, of course. Just joking. You guys don't have to try this, but so these are one of the things that people are trying to do. But at least if you can do the basic ones, that itself is very good enough. Okay. So what are the take-home message? Please beware of the chair. It may seem very comfortable, but there is a lot of side effects. A lot of, it can cause a lot of dysfunction to you. So sitting is the new smoking is actually a big, very famous tagline these days. Sitting is the new smoking. If you think smoking is bad, causes a lot of issues to people, sitting is equally as bad as smoking. So don't think you sitting too long is fine. Okay. So always remember, keep yourself active and healthy, because you want to be pain-free. You want to be able to do things that you can do without any issues. Okay. So thank you. And this picture shows that you just have to make sure your spine is always straight whenever you're doing anything that is prolonged, sitting for a very prolonged time, a period of time. Okay. So thank you. Have a nice day.